Hello everyone, myself Tulsi Patel. I am a nursing teacher working at Knowledge Institute of Nursing. So today we will talk about health assessment. So what is the definition of health examination? So health examination is the systematic assessment of human body which involves the use of one sense to determine the general physical and mental condition of the patient. So, what is the meaning? Like to diagnose the patient, to find out the problem of patient, you have to first examine the patient. Physical examination is defined as complete assessment of patient's physical and mental status. It is the systemic collection of objective information like which you can observe by your vision or you can do it sense and that is directly observed or it is elicited through examination techniques which we are going to learn in this video. What are the purposes of physical examination? So to establish a nurse and client relationship, it is most important thing to provide care to the patient, to gather data about the client's general health status, integrating physiology, what is the psychology of patient, what is his or her cognitive level and socio-cultural and developmental and spiritual dimensions of the patient. It will going to help a lot to understand these things. Then identify client strength. Identify actual and potential health problems. Actual means which is client is suffering right now, and potential means which is going to occur due to actual problem. Then establish a base for the nursing process and like what are the care you are going to implement on the patient to for his or her good recovery, and it is going to help in that to evaluate the physiological outcome of care. What are the indications of health examination? Like when should you perform the health examination? So first, when client is going to admit through OPD or emergency, you have to do this examination. In emergency, you have to do it first, like in hurry. We have to see the major things first, then on discharge to evaluate your care and to evaluate recovery, on follow to see how the recovery process is going on, then in health camps, then before and after diagnostic and therapeutic procedure. Then we will see the methods of examination patient. So the first and foremost method is inspection, a method of systemic observation. Inspection should begin with general observation of the patient, progressing to the specific body areas. So when the patient does enter into the ward or OPD or emergency room, your observation should start from there and then only. So what is the inspection? What we are going to see for in this method? So visual assessment of patient and surrounding, finding that may be significant are patient's hygiene and clothing, eye gaze. Certain eye gaze are indicating some disease condition, so you must have to observe for that. Then patient's body language, body posture and position, then skin color, whether patient is cyanotic or whether the patient is having yellowish discoloration or pale. You have to observe that. Then order, like certain drug abusers and alcoholic, you can just smell it and you can sense it that the patient is alcoholic or have taken some drug abuse. And nurse should observe patient's body part. Pay attention to clients watching all movement and looking carefully at any body part. It helps to know physical characteristics. Quality of inspection depend on the nurse's willingness to spend time during the job. Then, if the emergency response was the patient's homemaker visual inspection for, then you have to see cleanliness. Then prescriptions, like what are the drugs on patient in, then, like, which are drugs patient is taking? Sometimes patient is taking heparin, morphine, and some drugs which are contraindicated for some procedures. So you must have to see this and medicines and illegal drugs, whether patient is on cocaine or any other illegal drugs. Patient who are suffering from mental illness may sometimes brings weapons which can be very threatened, like for homicide or suicidal kind of tendencies. Then signs of alcohol use. What are the principles of inspection? So make sure good lighting is available. That's how you are going to examine the patient, right? So you can visualize patient's all thing easily. Position and expose body parts so that all surface can be viewed. Inspect each area of size, shape, color, symmetry, position, and abnormalities. If possible, compare each area inspected with the same area on the opposite side of the body. Use additional light to inspect body cavities. Do not hurry in inspection because it is very important to diagnose the problem. It is going to help you a lot. Pay attention to detail. Then we will see the second method, which is called palpation. So the process of examining patients by application of the hands, it is used to determine the consistency of tissue, alignment and integrity of structure. Usually we are doing, in majority times we are doing it on abdomen. Then symmetry of body parts and areas of warmth and tenderness. Tenderness means we are touching the patient and patient will feel pain. So we must have to do this process. Then types of palpation. The first one is light palpation to check muscle tone and assess for tenderness. How we will do this palpation? So place the one hand with the finger together parallel to the area being palpated. Press down 1 to 2 cm only. Repeat in every widening circle until the area to be examined is covered. It is easily shown in figure and you can easily do it. And the deep palpation to identify abdominal organs and abdominal masses. So what is the technique? So as shown in figure, with the fingers together, approach the area to be examined at 60-degree angle and use the pads and tips of the finger of one hand to press in 4 centimeter. Two-handed deep palpation is also there. So press two-hand deep palpation, place the finger of one hand on the top of those of the other as shown in figure. There are other palpation also. So deep slipping palpation, bimanual palpation, deep press palpation and allotment. Deep slipping palpation means the examiner uses his forefinger, middle finger and ring finger that are tightly together, slowly and gradually palpate the abdominal organs or masses, slipping up, down, right side and left side. It is frequently used for examining the deep mass of abdomen or GI lesions. Then we will see about bimanual palpation. It uses two hands, one on each side of the body part being palpated. So placing the left hand over the back of the organs to be examined in order to fix or evaluate the organs, and it may be helpful for the right hand palpation too. It is employed during the process of liver, spleen, kidney or abdominal masses examination. So sometimes some patient may like suffering with hepatomegaly or splenomegaly. So you can easily identify by doing this palpation that patient may have chances that patient may suffer with hepatomegaly or splenomegaly, and then you can go for further diagnostic tests. So that's how we are going to do the bimanual palpation as shown in figure. Then deep press palpation. The examiner uses his thumb or toothed finger together to palpate with gradually increasing pressure. In order to identify deep organ lesions or localize the area of abdominal pain, such as the pain produced by inflamed gallbladder or appendicitis, you all may be very familiar with the appendicitis too. So in patient with abdominal pain, there will be rebound tenderness. So what is the rebound tenderness? It is sign of peritoneal irritation and can be elicited by palpating deeply and slowly in an area from the suspected area of the local inflammation. The palpating hand, it is then quickly removed. The sensation of pain on the side of inflammation that occurs on release of pressure, it is called rebound tenderness. We can easily see in the patient with appendicitis. Ballotment. The examiner places 3-4 fingers together on the surface of suspected abdominal area and push quickly and shortly for several times with the motion from the wrist. The fingertips might be feel the abdominal organs are floating because it is producing ascitic waves employed in palpating the enlarged liver, spleen, and masses. Like in hepatomegaly and splenomegaly, we can do this too. It may also elicit uncomfortable of the patient. It is suggested do not push too hard because patient may get harmed. Then what are the parts of hand used for the various palpation? So your fingertips is going to assess texture, shape, size, consistency, and palpation. Then the dorsum of hand and fingers are to assess the temperature. The palm of hand you are going to assess the vibration. Then pinching of fingers to assess turgor consistency and position. Then the next is for light palpation. You are press skin gently with the tip of toe or three fingers held close together. You are going to use the pads of the middle three finger as shown in the figure. Then there are four quadrant we can divide our abdomen in. So what is in right upper quadrant are liver, gallbladder, duodenum, pancreatic head, and right kidney, hepatic flexure, and colon. Then what is in left upper quadrant? So stomach, spleen, left kidney, body and tail of pancreas, splenic flexure, and colon. Right left right lower quadrant you are going to see for cecum, appendix, right ovary, and fallopian tube. And in left lower quadrant you are going for sigmoid colon, left ovary, and fallopian tube. And you are going to palpate midline structure for urinary bladder and uterus. So this is going to help in palpation. Like you must have idea about organs that which organ are in which quadrant located. Like so the third method is percussion. In this method, we are tapping of the body lightly but sharply to determine the consistency of tissue and our organs through vibration and areas of tenderness. Striking of the body surface with short, sharp strokes in order to produce palpable vibration and characteristic sound. You have to just remember the four hairs like to the body surface with the short, sharp strokes. That's how you are going to percuss the area. It is used to determine the local location, size, shape, and density of underlying structure, to detect the pressure of air or fluid in the body space, and to elicit tenderness. There is there are types of percussion. The first one is direct percussion. Percussion in which one hand is used and striking the finger of the examiner touches the surface being percussed. So what is the technique? Using sharp rapid movement from the wrist, strike the body surface to be percussed with the pads of 2, 3 and 4 fingers or with the pad of the middle finger alone. Primarily used to assess the sinuses in the adult. You must have idea about what are the sinuses, right? Then indirect percussion. Percussion in which two hands are used and the flexure strikes the finger of the examiner's other hand, which is in contact with the body surface being percussed, which is called pleximeter. What is the technique? So strike at a right angle to the pleximeter using quick, sharp but relaxed wrist motion. Withdraw the plexus immediately after the strike to avoid damping the vibration. Strike each area twice and then move to the another area. The third one is blunt for the blunt percussion, you are going to use ulnar surface of the hand or fist is used in place of the fingers to strike the body surface, either directly or indirectly. So in the percussion, may have there are sounds. So the first sound is resonance, a low pitch and loud sound heard over the normal lung tissue. So resonance is normal at when you are percussing at the lungs area. The second one is hyperresonance. It is very loud, very low pitch sound, longer than resonance, signifying emphysema. Then the third one is tympani, a drum-like sound heard over the air-filled tissue such as gastric air vapor. So tympani is even not normal. Then the dull is the medium pitch sound with the medium duration without resonance heard over solid tissue such as heart and liver. So it is normal, right? So partition sound with the example. So if the dullness comes in your finding and the intensity is medium and the pitch is moderate, and you can find out it is at level. Then the second one is resonance. It is very loud intensity and it is low pitch, and it is normally placed at lung. Then the third one is hyper resonance. It is very loud and the pitch is very low, and you can hear over when the patient will have emphysematous lung. Then the fourth one is tympani. The intensity is very loud and the pitch is too very higher. It is at the puffed out cheek gastric air bubble. So resonance is hollow lung sound, for example at normal lung. Hyperresonance is booming sound at emphysematous lung. Tympani is musical or drum-like sound. You will find it at stomach and intestine. And the fourth one is dullness, that is thought sound and enlarged spleen and full bladder and liver. Then flatness, extremely dull sound. It is found out at muscle or bone. The fourth method is auscultation. It is the process of listening for sound over a body cavities to determine presence and quality of heart, lung, and bowel sound. Right? So there are types of auscultations too. There are direct auscultation to use. We can use of unaided ear, and indirect auscultation with the use of stethoscope, which we are all going to use, or even the doctors, physicians, and nurses and physiotherapists. We all are using this stethoscope. Then the, at, we are usually use it to determine the heart sound and lung sound mainly, and even the vowel sound sometimes, right? So for heart sound, there are four valves we are going to assess, right? So the first one is aortic valve, which is placed. You must know the placement to auscultate the heart sound, right? So for the aortic valve, you are going to place it at right second intercostal space, sternal border. Then the second one is pulmonic valve. You are going to place it at left second intercostal space, sternal border. The third one is tricuspid valve. It is at left fifth intercostal sternal border. And the most important one is mitral valve. It is situated at left fifth intercostal mid clavicular line. So that is the method of physical examination. Hope I have you must have understood the methods of physical examination.